Now we learn what are the indications for intrauterine insemination. What are the indications of intrauterine insemination? What are the indications of ICSI and all? First, intrauterine insemination. There are three indications. One is if there is any difficult vaginal intercourse. Okay. Two is if the male partner is HIV positive, and we want to go for sperm washing techniques and all. For them, you go for intrauterine insemination after sperm washing. Third is if there are any same-sex relationship. Okay, if they're both females got married and they want kids, then you'll go for IUI to the female partner with the donor sperm. In that case, also we'll go for IUI instead of IVF. Okay, these conditions. Okay, these are different conditions where you go for IUI, intrauterine insemination. Okay, now we learn about conditions where you go for ICSI. ICSI. Okay, intracytoplasmic sperm insemination. In these four conditions, there are four conditions. Here there are three conditions. Here there are four conditions. Okay, what are the four conditions of ICSI? One, there is severe deficits in semen quality. When there is severe deficits in the semen quality, like if there is a oats, okay, oligo, asthenotetrospermia, or sperm count is less than 5 million. In that way, if there is severe oligohydramnios, then also you'll go for ICSI. Second is if there is obstructive agiospermia. Second is if there is obstructive agiospermia. What are the conditions of obstructive agiospermia? That means brain big boss is normal, testis is also normal, sperms are producing, but it's not coming out. Okay, that is coming, not it is not coming out. So this is post testicular defect. This is post testicular defect in which you'll have normal FSH, normal LH, okay, normal LH, and the testosterone also normal, but sperm is not coming out. Okay, that is obstructive agiospermia. Next one is non-obstructive agiospermia. In non-obstructive agiospermia also you will go for ICSI. Okay, non-obstructive agiospermia is there is no obstruction. There is no obstruction. Okay, but sperm is not at all formed inside the testis. Okay, sperm is not at all formed. That is pretesticular defect. In that case also you go for ICSI. Fourth thing, if there is a failed IVF has been failed. IVF they tried for a couple. They tried IVF. Okay, they tried IVF and it failed because of severe male factor. Because of severe male factor. Then next cycle of IVF you can go for ICSI. You do ICSI and then transfer that embryo into the female. Okay, after doing ICSI you transfer. So these are four conditions for ICSI. Okay, that's about ICSI. Now we'll learn about what are the different conditions of embryo transfer age wise. Okay, age wise embryo transfer. If in the question they will give you particular age, so how many embryos you need to transfer, that you need to decide. First thing, age, less than 37, 37 to 39 and 40. Okay, less than 37, 37 to 39 and 40. In that first cycle of IVF, in case of first cycle of IVF, okay, so 37 or less than 37 years, mainly 37 years, 36 years, in that people, we will use single embryo transfer in the first cycle. Okay, if this failed, then the second cycle will go for top quality present. See, embryos are formed in which one will be top quality. So top quality embryos are present, then you'll go for single embryo transfer. And there is no top quality, then two embryo transfers will do. Okay, no top quality, then you'll go for two embryo transfer. That is in second cycle. Third cycle is we'll go for no more than two embryo transfer. No more than two embryo transfer. This is about less than 37 means 36, 35, 34 age people. For embryo transfer, you'll follow this. So first thing is first cycle. They came for first cycle of IVF. They will ask this question. First cycle of IVF, if the 35 years old lady came, then you'll transfer her single embryo transfer. But in case of 37 to 39 years, already they are old, a little old, right? So for them, in first cycle itself, you'll go for top quality. Top quality means single embryo transfer. If there are no top quality embryos, then you'll go for two embryo transfer. Okay, this you'll follow. Even in second cycle also, you'll follow the same. And in third cycle also, no more than two embryo transfer. The same. If a 40 years old girl, old lady came, 40 years, she's old. Okay, very old. So 40 years old lady came, then you'll consider her for double embryo transfer. Okay, double embryo transfer. So according to talk article, if a young lady, if a young lady came, if a young lady came with the first cycle of IVF, then you'll use single embryo transfer. That is the thing. That is the thing in case of embryo transfers. Okay. Next, last, I want to tell you about unexplained infertility age-wise, when to do what. Okay. So this is also one of the thing where you get confused. So in unexplained infertility, you will see if a couple came, they're saying that 2 years so 1 year they tried UPSI, it didn't work. You did investigations, it was normal. You said try again. So they tried UPSI for 1 more year, then also not worked. So 2 years they tried with normal investigations. That person is known as unexplained infertility. At the time, you'll take the female partner and you'll see the age of the female partner. If she is less than 36 years, if she is less than 36 years, okay, so the 2 years you will wait, age only 2 years you will wait, and you'll go for IVF. If she's 36 to 39 years, okay, 1 year only you will wait and you'll go for IVF. If she's more than 39 years and they tried UPSI but didn't work, then you'll directly go for IVF. This is the thing, okay? So if she's less than 36 years, normally we'll follow this. If she's less than 36 years, 2 years, then IVF. But if she's 37 years, okay, she's 37 years or 38 years, then 1 year only. You don't ask her to wait for 2 years. Okay, you'll ask only for 1 year, then IVF. Okay, that's about unexplained infertility. Next, we learn about important flow chart is male infertility. Male infertility. If a person came, if a couple came, okay, female totally investigated, she was normal, she's ovulating, her endometrium is also forming, very good. But male factor, there is infertility. Then you'll go for history and examination first. How to rule out? Okay, you'll go for history and examination. Then obviously you'll go for husband semen analysis. Okay, husband semen analysis. Okay, if the semen analysis is less than 5 million per ml, if the sperm count is less than 5 million per ml, then you'll go for hormones, that is LH, FSH, testosterone, prolactin. Okay, these hormones are tested. Okay, sometimes you can go for testicular biopsy, so that we can extract the sperm and you can proceed with ICSI. Okay, so whatever the test hormones have been done, so these hormones you will see. Okay, if FSH is low, LH is low, testosterone is also low, that means I already told big boss is problem. So the test is also is not it is not hormones are not acting on that. So that is known as hypogonadotropic hypogonadism. Okay. So for in this case, in this condition where all low, in these conditions, you can, so as there is hypogonadotropic, so you can give gonadotropin releasing hormone GnRH. Okay, you can go with ICSI, you can go with IVF, or finally, if it is not working, you can go for adoption. Okay, everything is line based, very important. Okay, as the hormones are affecting, so you will give GnRH. If it is not working, you can go ICSI. Okay, what you can go for testicular biopsy. Okay, you can go for testicular biopsy, and you can go for testicular biopsy, and you can go for testicular biopsy, and okay, testicular biopsy, and you can extract the sperm and go for ICSI. Okay, if and followed by IVF. If not working, then is adoption. Next is if the FSH, LH, testosterone all are normal, means big boss is normal, testis is normal, but sperms are also forming, but it's not coming out. It's not coming out. That is known as obstructive agiospermia. That is known as obstructive agiospermia. So what we'll do? We'll extract the sperm from the testis. Okay, we extract the sperm from the testis. That is ICSI. Then we will do ICSI. Then you'll go for IVF. If it is not working, then you can go for adoption. Okay. Next scenario: if FSH is very high, LH is also high, but testosterone is low. That means big boss is producing hormones, but testis is not reacting. In fact, it is producing less testosterone. In this is a particular example. This is a particular example for non-obstructive agiospermia. Very good. Non-obstructive agiospermia. In this, you can go for ICSI. Whatever small sperms which are available, you can extract that and go for ICSI. Or you can go for donor sperm. Okay. You can go for donor sperm and finally adoption. Okay. Last is genetics. If genetic diseases are there, then you first will refer her to genetic department, and you can go for ICSI, you can go for donor sperm, or you can go for adoption. So very important here is, if you see properly, each and every part have ICSI. Okay, these are all indications for ICSI. Okay, even hypogonadotropic hypogonadism, ICSI. Okay, obstructive agiospermia, ICSI. Non-obstructive dyspareunia, ICSI. Genetic diseases, ICSI. So these are different indications for ICSI. Okay. So this is about male infertility. I'll give a small charting about that. It'll be easy. Hmm. So FSH, testosterone, and diagnosis. Okay. If big boss is normal, testosterone is normal, sperm is not coming, that is obstructive azoospermia. If big boss is high, FSH is high, testosterone is low, that is testicular failure. That is testicular failure. See, big boss is producing hormone. On testis is not acting. That is testicular failure. Okay, that is testicular failure. If FSH is low, testosterone is also low. That is secondary hypogonadism. That is secondary hypogonadism. It is pre-testicular failure. Okay. So in pre-testicular failure, pre-testicular it is low, pre-low. Okay, pre-low. If FSH is low, testosterone is high. That means see, when if big boss is low, then obviously testosterone should be low, na? Or else it should be normal. How it is becoming high? Externally, this person is taking something. That is anabolic steroids. Anabolic steroids. Okay. So remember this, a low FSH, generally low FSH if it is present, it can be present in case of anabolic steroids or it can be present with Kallmann syndrome. I already told man is low. Okay, Kallmann syndrome, there is low FSH. Okay. Once again, I'll repeat these conditions of uh, male thing, male and embryo transfer. So initial thing is first you'll go for indications of intrauterine insemination. Three indications. If there is any vaginal intercourse problem for the female, like psychological problem, the psychological problem, vaginal introitus is small. In that conditions, you can go for directly IUI. Okay. Or else if the male is HIV positive, he want to wash the sperm so that the offspring doesn't get HIV. Then also you can take the semen sample, wash the sperm, and washed sperms can insert into the vagina. I mean into the female genital tract by means of IUI. Or else in case of same-sex relationship, like female are married, and the female partner can get a donor sperm by means of IUI. Instead of IVF, they can go for IUI. That's about IUI three conditions. Four conditions of ICSI is all sperms, all sperm defects like oats, obstructive dyspermia, hmm, non-obstructive dyspermia, and last is if there is severe male factor defect, severe male factor defect. Coming to embryo transfer, if a couple came and they're asking for embryo transfer, how many embryos you'll transfer for me, then you'll see the age of the female. If the female is less than 37 years, in first cycle you go for single, second cycle you go for double, third cycle also not more than two. If she is 37, 38, then top quality only you'll go for single. If not, you go for double. 40, very old people, 40 years of age, you'll consider double embryo transfer itself. Next, if a couple came unexplained infertility, you ask them to try for 1 year and one more year after investigations. But if she's 36 years, you'll follow this 2 years thing. If she's 36 to 39 years, that is like 37 years or 38 years, then you'll go after 1 year only, you'll go for IVF. If she's more than 13 years, 39 years, you'll go for IVF. Okay. Coming to male factor infertility, you'll take the history, you'll take the examination, you will take the semen analysis. If he is 5 million, less than 5 million sperms per ml, then you'll go for hormonal testing. Okay. In hormonal testing, if everything is low, big boss is low, testis is low, that is hypogonadotropic hypogonadism, then you'll give GnRH, ICSI, IVF, and adoption. If the big boss is normal but testis is not producing, if big boss is normal, even the testis is normal, but sperms are not coming out, that is obstructive azoospermia, in which ICSI, IVF, adoption is done. If big boss is high, FSH, LH is high, but testosterone is low, that means it is non-obstructive azoospermia, ICSI, donor, and adoption. Genetics will refer to genetic cream, ICSI, donor, sperms, and adoption can be done. So this is a 4 into 4 chart. Okay. If FSH is normal, testosterone is normal, everything is normal, but it's not coming out obstructive. If FSH is high, testosterone is not low, that means testis is low. Testosterone is low means testis is not producing testosterone. That means testicular failure. If FSH is low, testosterone is also low. That means totally there is hypogonadotropic hypogonadism, that is pre-testicular failure. So pre-low. And in this kind of low FSH is seen in Kallmann syndrome. If FSH is low but testosterone is high, that means somewhere around outside they're having some steroids. That is anabolic steroids. Okay, that's it. Thank you.